We're just trying to make sure that that we got the on-call doctor to communicate.
I'm going to speed this up. The transcription is completely jacked up because Otter will record it, but it hates editing. This was a gentleman who was on 60 liters high flow. It was August 28th of 2021. They were telling his wife, who was day 9 of COVID. She contacted me on day 8, on Friday evening. It was 10 o'clock. I had pulled over into the Walmart parking lot about 10 minutes from home, a place I hadn't been in for 2 days. And I had told Shelly, I've got a phone call to make, and then I'll be home. So I ended up contacting this woman to make sure she got a hold of her, got her meds from the pharmacy, which she did not because of the pharmacy. I was 10 minutes from home. She then tells me that her husband is in the ICU. I told her I would call her back. I hung up, sat in my car for a minute, thinking, good Lord, what am I going to tell Shelly? Because I had gone into this woman's chart and looked at her address, and it was 35 minutes the other way. And I said I was going to be home in 10 minutes. Oh, the lies I have told to Shelly. I called her and I just said, I'm so sorry. I have to do this. And I drove back to Camas, Washougal. Dropped off the meds that she wasn't able to get at the pharmacy. And showed her what to do to save her husband's life. This is a conversation with a hospital. And so she called me the next day. We were having a lovely evening at our friend's house when I got the call that they were going to put him on a ventilator. And obviously I freaked out, as anyone with a soul would. And I said, call the hospital right now. I'm not going to record the entirety of this. And obviously, as you will see, the transcript is not even remotely synced up with what was said. But this was one of the more diabolical nurses, Nurse Kristen. The nurse that's on the phone right now is actually quite pleasant. Thank you, nurse.
With us tonight about how Chuck's doing.
Well, the on-call doctor right now won't really know how he's doing because they just round on all the patients in the hospital.
Yeah, I understand that. So
the one that follows his treatment and orders treatment plans is the day shift attending doctor.
Yep. So
but he's no longer here.
Right.
But I've already seen him, and he's doing pretty well right now.
Yeah. How's his pneumonia?
I mean, it's still there. We're just managing the oxygen level.
What treatment is he getting for his pneumonia?
He's getting steroids.
Okay, so he's got a secondary pneumonia, and steroids don't cure pneumonia, and you know that. I've never been able to cure pneumonia with steroids. I have to do IV antibiotics and oral antibiotics. So the reason we want to get in touch with the on-call doctor is so we can treat his pneumonia, because if we don't treat his pneumonia, he's not going to do very well. So we need
As
somebody.
far-
We need somebody that's willing to treat his pneumonia.
Yeah, as far as I know, it's not bacterial pneumonia. It's all viral due to COVID.
So you've done blood cultures and sputum cultures?
No. We only do blood cultures if they have fevers or a high white blood count, which he does not have.
Yeah, I don't do that. I do it whenever there's a suspicion of pneumonia and X-ray evidence of pneumonia. And usually what I get back is high count Varicella catarrhalis or high count Haemophilus influenza or strep pneumonia. And since we know that COVID as a virus has a high probability of causing secondary bacterial pneumonia, if we don't treat with IV antibiotics, and like Rocephin and doxycycline, patients have a much poorer prognosis. And I've done this for the last 15 months. I've advocated for patients at Legacy in Salmon Creek and in Portland, and we've had some doctors that are willing to do it, and they end up going home.
Yeah.
So what I'm trying to do is make sure that we remove the idea that a viral infection can't possibly, I mean, I've had patients that have had influenza, which is a virus, and they later had a secondary bacterial pneumonia.
Mm-hmm.
So the idea that...
They would initiate that if he actually decompensated and got worse. And right now he's been doing pretty well. I mean, right now the one that's following him is the attending during the day.
Right.
And
But he's...
non-call doctors won't know.
Yeah, they do.
They don't know him.
Yeah, but you don't have to know somebody. Like, I don't know him. I haven't met him. I know his wife, and I know the situation, and I know how the disease progresses.
And that's something, I mean, I can always, I can leave a note, and I can even...
So what we need to... Who is the on-call doctor?
We have a couple, which...
Who would be the one that would have 5 minutes to care about him?
I would have to double check because we have like 4 of them on right now.
Perfect. No, that means that there's somebody that has time to do something tonight to help him. I manage 60 COVID patients a day, and I don't have 4 other people to do it. So the fact that there's 4 is awesome. That means that somebody has the time to make sure that he gets the treatment he needs.
Well, like I said, I can definitely relay the message and see if they can call you back.
That'd be great. For legal purposes, we need names of people that are supposedly devoted to making sure that he does okay. I mean, just saying that somebody's going to possibly call us back. Nobody called us back last night. Waited all night.
Yeah, that I don't know.
I know that's not your fault. That we waited all night for somebody to call us back and nobody did. So we just need the names of the people that are responsible for managing his care, or that can make changes to make sure that just crossing their fingers and hoping that he somehow beats an organized pneumonia with no medication, that we know who it is. That's all.
I've already mentioned Dr. Chet, who's following.
That's a daytime doctor. I'm talking about the people that have the ability to help him tonight.
Yeah, I mean, and that's what we're doing. We're following the doctor's orders, whatever it is.
There are no orders.
There are orders.
What are they?
We have meds.
So what are the orders for antibiotic treatment?
The regular antibiotics.
Exactly. So there are no orders. I'm asking who is responsible tonight to help him.
Hang on. I'm going to put you on hold for just a minute.
Thank you.
They hate me. So, I wasn't trying to be rude. It's a human life in the balance. And a nurse is just doing her job. Protecting the doctors from doing their job. I was in my anger and helplessness with not being able to just go in there. And by the way, he lived. He went home, despite the hospital. That was Saturday night. He walked out of the hospital Tuesday morning. They gave him nothing. He walked out, sitting at 94 on room air. They have no idea how he did it. And it was the night before, what we were able to do. And glory. I mean, thank God he lived, because the rightful, justice, how do I say it? The crap storm that I endured from my family, again, rightfully so, for going a third day without seeing them, for him to have not made it, probably would have broken me. But, anyways, just,
There's 4 doctors.
we were at a friend's house. We were at a party when I got this call, and I had to recuse myself from the fun and wandered through their house pretending that, when I was on hold, that I was present and engaged. No, I said that wrong. Yeah, it was the night before that. Yeah, when I had gone back. So this is Saturday, so I'm finally hanging out, hanging out with friends. It was just a wonderful evening, and then this happened, and I had to hit the pause button, and even my friends are like, "Are you kidding? Have some boundaries." And I was like, I don't know. Your wife, mother-in-law, and brother-in-law almost died. So just cut me a tiny bit of slack. Just a tiny bit.
4 doctors on call. What does she make it sound like? There's 1 doctor. 1 doctor. There's 4.
You have your belongings.
So 4 doctors and no one.
Where are we?
Hi, this is Kristen, the charge nurse.
Hi, Kristen.
Kristen is not a kind woman. Kristen is an angry woman. Kristen hates truth. Hold on, I'm walking past our chicken's white noise machine. Oh, Chippy. Shh.
Kristen.
Hello? Hi, who am I speaking to?
Kristen, this is Sherry Newby. I'm Chuck Newby's wife. And I have a good family friend on the phone, Christopher, that's trying to help me advocate for care for Chuck.
Okay, what is your concern? The care that you're concerned about?
Well, he's got organized pneumonia. It's
Who
being
does?
Chuck.
Has organized
He's
pneumonia.
got pneumonia.
Okay.
Right.
You're asking me or
No, we're telling you that's what the diagnosis is. He's got pneumonia.
Well, these are questions I can't answer from here.
No, they're not. They're not. Not
But if
quite.
Sherry,
Not
but
quite.
if Sherry wants,
Oh, sorry, Sherry.
Give me just a moment. If Sherry wants to ask them, I'm happy to answer them to the best of my ability.
Okay, so does he have organized pneumonia?
Your husband's admitting diagnosis is COVID-19 viral pneumonia resulting in hypoxia.
So he's got pneumonia.
Is It is a viral pneumonia, yes.
Based on the cultures?
Again, if you want to ask...
Sorry, Sherry, are they based on the blood
Is
culture?
that based on cultures?
No, that is based on a PCR swab.
Nobody there to advocate for. Do you not understand her? I can't come in there with him.
Sherry, you do not understand what he has. What you are describing, antibiotics, are effective for a bacterial... What I'm picking up.
Well,
I am concerned. I'm concerned that he's not getting.
Resulting in hypoxia. It is a viral pneumonia, yes.
based on the cultures?
Again, if you want to ask...
Sorry, Sherry, are they based on the blood
Is
culture?
that based on cultures?
Sorry, I had to go back in time.
No, that is based on a PCR swab.
So, Sherry, so basically what they're saying is because they did a PCR and it was positive for COVID, that there's no possibility that there can be a secondary bacterial pneumonia, which is always a likelihood as a secondary
Sherry,
cause of infection.
I just want to be very clear with you. That is not at all what I'm saying. I'm not sure the dynamic that is going on here, but what I am going to say is this. Your husband is very sick. Very sick. And he is in a hospital full of critically sick people. In a community full of people who are very sick with COVID. And I can tell that you care very much about your husband. I mean, that is very clear, and you are right to be concerned and worried. I would also be concerned and worried. I am concerned and worried for your husband and the other patients who are here and as sick as he is. It sounds like you're worried that he's not getting adequate care. Is that what I'm picking up?
Well,
I am concerned. I'm concerned that he's not getting antibiotics, that the doctors have a protocol that says check off a list, just roll him on his tummy and put the CPAP on him and crossing our fingers and hoping he's getting better. But there's things that can be done, and I don't feel like anybody's wanting to do them because it doesn't fit your checklist. And so what Christopher and I are trying to advocate for him is, can we get him on IV antibiotics and try to combat the pneumonia that he has? If he's still coughing up stuff, he still has it, and he's not being treated for it.
So what it sounds to me is it sounds like he's concerned that he's not getting adequate treatment for pneumonia, but the kind of pneumonia that you're describing, that you're concerned about, a bacterial pneumonia, is different from a viral pneumonia.
Then how do you figure out that he doesn't have a bacterial pneumonia? You haven't swabbed for it.
If you'd like me to have this conversation with you, it's going to have to be a back and forth where I also get to talk.
you've been talking to her and she's asking you a question.
And I am not going to talk to you anymore, sir.
No, I need him to be up here.
He can listen. I am not going to have this discussion with him, and I will have a discussion with you if there is a respectful back and forth where I am allowed to answer your questions and correct you if your interpretation of what I'm saying is wrong. But I do not have the time to spend arguing about things. That I don't have time for.
Wow.
There are a lot of very sick patients here.
So
There's nobody there to advocate for. Do you not understand her? I can't come in there with him.
Sherry, you do not understand what he has. What you are describing, antibiotics, are effective for a bacterial pneumonia. A bacterial pneumonia and a viral pneumonia present very differently.
Sherry, she does not. I'm talking to Sherry.
I'm going to end this conversation.
Please don't do that. He's trying to give me.
No, I am not going to do this. This conversation is about to be over.
Okay.
I'm happy to explain it to you, but I will not argue.
Hold on just a moment, please. Please. I don't want to end this call.
I don't want to either.
I'm scared. I don't know what to do. You guys haven't called me. He's been there for 3 days. I've not had a doctor call me once. I am told I can call and talk to nurse. You guys are not communicating with me. What resource do I have but to go outside and have somebody who's willing to communicate and help me through this with us, because the hospital is doing SWAT. And they're not telling me. He doesn't know what's going on. They're not talking to him because nobody wants to be in the room because they have to gown up and he's infectious. I get it. but it's still a life, and it's still a life that I love, and I will fight for it, and I need to have Christopher on the phone, and if you won't talk directly to him, which would solve a whole lot of problems, you have my consent to do that, then he wouldn't feel like he has to interrupt to give me the questions to ask you.
But you aren't the one who can give me that consent. That would be your husband, and he would have to make. But you aren't the one who can give me that consent. That would be your husband, and he would have to make Christopher his new emergency contact. That's how this works. We are too busy to talk to multiple people. Number one, okay? That's why we have one person. And I apologize if a physician hasn't given you a call to kind of like go through things with you. And I am happy to do what I can from where I'm at to try and remedy that. But as I'm not here during the day, I can't guarantee it. But there are things I can do to try and help with that. Okay? And I'm willing to do that. Happy to do it.
Can you have the on-call doctor call her?
I will hang up this phone and we will be done talking tonight if you speak again. I am happy to talk to Sherry.
But he's giving me information I need to ask because I don't know the questions.
But you aren't the one who can give me that consent. That would be your husband. And he would have to make Christopher his new emergency contact. That's how this works. We are too busy to talk to multiple people. Number one, okay?
Sorry, I don't know why it keeps jumping back. I'm glad it did, because this nurse is full of a level of crap that is fortunately rarely seen.
Okay? That's why we have one person. And I apologize if a physician hasn't given you a call to kind of like go through things with you. And I am happy to do.
I apologize that no one has called you to share any information with your husband and possible therapeutic regimens to keep him from getting on the ventilator that at this hospital had an 8% survival rate. Sorry for no one doing their job. I don't know that sorry cuts it.
Do what I can from where I'm at to try and remedy that. But as I'm not here during the day, I can't guarantee it. But there are things I can do to try and help with that. Okay? And I'm willing to do that. Happy to do it.
Oh.
Can you have the on-call doctor call her?
I will hang up this phone and we will be done talking tonight if you speak again. I am happy to talk to Sherry.
But he's giving me information I need to ask because I don't know the questions to ask.
Then he can write it down or he can talk to you in person, but I am not going to argue or be interrupted over this again. You are right to be concerned, and I want to explain to you what we are doing for your husband and why we're doing that versus antibiotics. And I'm happy to do it, but I do not have time to waste arguing. So if you and I want to talk, that's great. And if he wants to give you questions to ask the physician tomorrow, that's totally fine. But I'm not going to continue this conversation again if I hear any more. Do you want to keep talking?
Yes.
Okay. So what I want to explain to you is that viral pneumonias and bacterial pneumonias are very different. They look very different on imaging, like clearly different. They also present differently with labs, and sometimes the symptoms present differently. That being said, you can have a viral and a bacterial pneumonia. We've had several people who have come in who have the COVID-19 viral pneumonia. And also, typically they don't come in with one, but they may develop one. Like if they're coughing and they choke and breathe something into their lungs, like a fluid, that can cause it. It's called aspiration, and that can cause a bacterial pneumonia. What I am seeing, based on, and let me look through the last most recent radiology image, okay?
Can I talk to one of the 4 on-call doctors?
You can't. And I'm not saying that I won't allow you to. I'm telling you they will not call you tonight.
Why?
Because they are slammed. And they are not going to take time to do a full, in-depth admission to tonight's review of your husband's full chart to be able to give you the answers you want. That's going to be the admitting or the attending physician that speaks it. The doctors that are here tonight and the pulmonologists and intensivists, they are familiar with the case. And we communicate if something goes awry. But they are not going to do that just to have a phone call tonight. They are too busy. So your husband, his x-ray and his lab both have zero evidence of a bacterial pneumonia at this point in time.
She's full of
And
shit.
the only thing that giving antibiotics, like a not indicated antibiotic, to someone with a viral pneumonia does increase the risk of them getting an antibiotic-resistant infection in another place. So the treatment for COVID that has...
So again, I was at a party and I was going from outside, muting it, and going from room to room, apologizing to people. So that's why there's background noise.
Many are a steroid that we use called dexamethasone. And if it is indicated, there is an antiviral infusion we give called remdesivir. I'd need to look and see if your husband qualified for it or not. It has to do with the onset of symptoms, like how far, based on his report to the physician, when the symptoms onset versus when he gets here. The only other treatment that we have that has shown really any significant effect for people with COVID-19 pneumonia, and it's a very narrow population of them, is it's a medication called tocilizumab.
It's tocilizumab.
Again,
It's called
this is the last time I'm saying this, I will hang up and we will be done talking tonight, and Sherry, can call and speak to patient relations tomorrow.
I will be doing that.
I will not speak to you.
Okay, well, you're
Literally, I just helped pronounce the medication that she knows nothing about and can't pronounce, but simply says that somehow there's a rare set of people that qualify for it. No, there isn't. It's anyone that missed the window on remdesivir. And before they were Pez dispensing out baricitinib. Are you kidding me? Like, they wanted to give tocilizumab every chance they could because it's like $8,000 to $10,000 per treatment. Gah.
well, you're speaking to me.
Okay. This is the last time I'm saying this. The next time I'm just going to end the call.
That doesn't help me. That doesn't help me out, Christine.
No, it doesn't. But you are not helping yourself right now, and I want to help you.
That doesn't help me. No, but you're not helping yourself. And I'm trying to help you. This woman is just pure evil. Like, I have nightmares on this call. And there's way more involved in this story and what happened after this call and the next day and what it took to get her husband home against all odds. It was so shocking what the hospital tried to do. I mean, they did, but we were able to undo it, which sounds even crazier. But this nurse, Kristen, just sinful.
I do. He is not helping you.
But saying that you're going to hang up on me is not helping me.
No, I'm saying I am not going to waste my valuable time that should be spent supporting the nurses trying to take care of your husband and their patients arguing with someone. I will tell you the answers that I have, and I will advocate and make a plan so that you can fall from his position tomorrow, but I won't do that. So the TOSI, that's what we call it. It's a very narrow population of people who can receive it. And I'm not even going to look and see if your husband qualifies because there is a nationwide shortage. We've had 2 doses in the last 4 weeks.
Complete BS. Like, this is end of August of 2021. They had plenty of doses because at the exact moment, at the similar moment that I was advocating for this, I was advocating to try and keep 5 other people off of it. So, Kristen, nope.
Come into our hospital. And we've been told by the manufacturers not to expect any more. We keep trying, but we haven't gotten it. So, the best thing for your husband, the thing that gives him the best chance of survival, is spending at least 18 hours of his day on his stomach, and I can explain why if you want me to in a minute, to wear the CPAP as much as he possibly can, and sometimes that means literally only coming off to have a meal. If he can tolerate it. We have people here who can't even tolerate that right now. Their oxygen demands are so great that when they come off, everything plummets. And sometimes when people go that low, we can't get them back.
So is he plummeting when he comes off to eat?
Let me look and see what his... Because I believe... Let me look here. Because I want to make sure I'm telling you correct information. No, he is doing okay on the high flow when he's eating. And if he can spend more time on the CPAP than he is now, that would be beneficial for him. If he could spend more time on his belly, that would also be beneficial for him.
Have you guys explained to him that he needs to be on his stomach for hours?
I don't know if the 18-hour, if the number of hours has been discussed with him. I'll touch base with Cecilia when we get off the phone and double check. I would be really surprised if it hadn't, because all of our respiratory therapists and all of our nurses from this unit have worked with COVID patients. We've had the most COVID patients us in the ICU since this started, more so than anyone else in the hospital. And if for some reason 18 hours hasn't been mentioned, or if it was mentioned, especially at a time when he was, kind of in distress, he may not remember it, but I will talk to Cecilia and make sure she reiterates the 18 hours, okay?
Okay, and what was your name again?
My name is Kristen.
Kristen.
Yeah. Now it looks like today his doctor was Dr. Chen. Yesterday. I'm trying to see if the admitting physician was, if it was Chen or if it was something.
So you said Dr. Chen.
Dr. Chen. I don't know that that's going to be who it is tomorrow. They typically work 7 days off. I'd have to go back through the whole call schedule to figure it out. But, we communicate with them throughout the day and throughout the night if we need to. And the best way for a night shift you have that I can't answer tonight, address some of your concerns, and then I'm also going to pass it off to my day shift counterpart, that's the day shift charge nurse, and she will follow up as well.
Call back in an hour and talk to the on-call doctor tonight?
You're not going to be able to talk to a physician tonight.
You're not going to be able to talk to a physician. So I'm furiously texting her. Because why shouldn't she be able to talk to an on-call doctor? They had 4 on-call doctors that weren't doing jack squat, right? They weren't managing anyone in the ICU. I mean, they weren't managing her husband. 4. So what were they doing? Why couldn't she spend 5 minutes talking to them? So if I call back in an hour, can I talk to a doctor? Nope. She hadn't been able to speak to a physician in over 24 hours. Why? They sure as shit weren't busier than me. I was busier than at least 2, if not 3, of those on-call doctors combined. Yeah, it was a Saturday night, and I was on the phone trying to ensure that her husband got care. We subverted, like I said, the hospital, but this is garbage. It just angers me, and I need to go back into my Zen state, but it's just a dumpster fire of lies.
I would love to tell you that they would, but they are too busy right now to have this kind of conversation. They are having a conversation about your loved one has now exceeded all oxygen requirements and is actively dying. What do you want to do? Those are the only conversations they have.
The only conversations if they're actively dying and what do you want to do? Really? Thanks, Nurse Kristen.
And because your husband at this moment is critically ill, they are not going to
So he's just basically in a holding center where he's just doing either miraculously gets better on his own or he gets worse.
with COVID, that's literally it. They come here and we provide support to their body. Like we support them with oxygen, with
So, if somebody has COVID, this is what they do. We support their body, like we support them with oxygen and pressurized airflow, and we monitor everything else.
pressurized airflow that helps keep their alveoli and their lungs open. We monitor.
That helps keep their alveoli in their lungs. No, you put them on high flow and you literally collapse their alveoli. They come in requiring 4 liters, maybe 6, and you bomb them with 40 to 60 and collapse their lungs. That's what you do.
Under everything else. So if because he's not able, he is now, but if you were not able to eat, coming off, he can't come off the CPAP, then we figure out an alternative nutrition plan. We address things like if their sodium gets too low, or if they begin to have like diarrhea from COVID, which sometimes happens. We're constantly monitoring their blood counts and their clotting factors because they're incredibly high risk for blood clots, and we have had a lot of people die from those. They get the blood clots as a result.
We've had a lot of people die from the blood clots. You're the hospital. A lot of people dying at home because of blood clots. Okay, right? You're the hospital, but you put them on 40 milligrams of Lovenox QD instead of like an aggressive anti-clotting regimen. So the fact, Nurse Kristen, that you are admitting that your hospital had a lot of people die from untreated blood clots, even though you knew they were clotting? What? That sounds crazy. I mean, of all the crazy, you just said that you had a lot of people die of blood clots. Yet, you're monitoring their D-dimer. I mean, no, you weren't monitoring their T-regs and VEGF and MMP9. You should have been. If any of the doctors had a brain thinker or weren't whored out to Satan to make boatloads of money. Sorry, Maggie. But keep going about how you've had a lot of people die from blood clots in the place that's supposed to save them from dying from blood clots.
So, you get the blood clots as a result. Blood counts and their clotting factors because they're incredibly high risk for blood clots, and we have had a lot of people die from those. They get the blood clots as a result. So,
they get blood clots as a result of COVID. No, they get blood clots as a result of non-treatment for their COVID. Nurse Kristen.
alone, they're supporting him to truly COVID when you are sick enough and you're critically ill. Like a good 80% of it is on you.
Hold on, we just got in the car. 80% of it is on what? What?
That's literally it from those. They get the blood clots as a result. So, he's not alone. They're supporting him to truly COVID when you are sick enough and you're critically ill. Like a good 80% of it is on you. I tell you, absolutely. Even if your husband does everything right, So it's moving forward from this
even if he spends 24 hours on his belly moving forward.
point, and he stays on the CPAP constantly except for the street, might still be moving.
There's actually, I just feel like there's got to be something more than just laying on your stomach. And I mean, there's got to be some sort of med that you guys can try.
Dexamethasone and the remdesivir.
Dexamethasone and remdesivir. So 24 hours on your belly. Dexamethasone and remdesivir. That's our hospital system. If your husband can't comply to 24 hours a day on his belly and doesn't somehow recover with a sub-pediatric dose of dexamethasone and a nephrotoxic and hepatotoxic experimental use authorization antiviral for somebody that is deep into the inflammatory phase. Expert nurse, Kristen.
How much of dexamethasone is he getting?
It's a standard dose. It's 6 milligrams. And let me look and see how.
And why don't you increase it instead of it being a standard? I mean, can't you use a higher dosage?
Patients that failed. I mean, even vitamin C. But most of them, like a vitamin C, you take it at home and it's okay. Like, if you take too much of it, you're just going to pee it out and it's not so big of a deal. But if you get doses, other things happen. Steroids are exactly the same thing. Powerful steroid. And giving him more, like there's a point you reach where you can give more and you don't get more effect. You just have more side effects or it starts becoming detrimental. And so this dose of dexamethasone is the set dose. If we were to begin just giving more, what can happen is people's blood sugars start to escalate and then it can also become an immune suppressant if we start giving more. So it's like a sweet spot with the dexamethasone.
It's like a sweet spot with the dexamethasone. 6 milligrams. If we start giving more, like 8, or like studies did, where they were giving 20 milligrams to children, it's like there's a sweet spot. A sweet spot of death. Nurse Kristen.
So you start him out on the lowest, and again, wait for him to...
No, it's a set dose. And it's a decent sized dose. It's 6 milligrams of dexamethasone. Typically when people get steroids for other things, like out in the community, we give them a different steroid for most things. Mm-hmm. This is a very unique steroid. We give them a different steroid and we give them a large burst of it. Oh, hold on, there's an emergency. Just one.
And we give them a different steroid and a large burst of it. It's called methylprednisolone. And it makes the bad go away. I gave 6 milligrams of dexamethasone to children with croup for their laryngotracheal inflammation. I've never given dexamethasone for anyone with pulmonary issues. In fact, I prescribed dexamethasone to over 1,000 people. And the minute any of them had any lower respiratory issues, any desatting, any shortness of breath, I immediately changed it to methylprednisolone because of its superior lung penetration, which literally every critical care intensivist pulmonologist knows. Even the ER doctors know this, which is why dexamethasone has never been prescribed in the ER for anyone with airway issues. I mean, lower airway issues with asthma or it's like it's never been done. But Nurse Kristen.
1 second, okay?
absolute garbage. That's what I would treat a 6-year-old with croup. So
No, I just said that.
if they put him on 248 milligrams of methylprednisolone, they would manage his blood sugar. That's super easy to do. Like, it's a no-brainer. Yeah, his blood sugar would go up a little bit. They'd give some Actos to drop it down, and inflammation in his lungs would go away. He'd be sitting up and walking around tomorrow. And I mean, just the way she's talking, like they don't want anybody that can ask questions to talk.
Not bad enough.
Are you there?
Yeah, I'm here.
Okay. I'm gonna help you. So, when we give people steroids at too high of a dose, it can act like an abuse problem. But in the community, when we give people steroids, like, they got a really bad, like, bronchitis and stuff going on, we give them a burst, and then we taper off.
We'd give him a burst and taper off. They never gave him a burst. This is a different kind of steroid. It's pretty unique. No, it's not. It's just wrong.
This is a different kind of steroid. It's pretty unique. And so we don't do that with dexamethasone. It's a set amount. We give it 10 days for dexamethasone.
It's a set amount, and we give it for 10 days. Regardless of decompensation, it's a set amount, and we give it for 10 days. Regardless of if the patient is improving or decompensating, it's just what we do, and we do not change it. Guess what, Nurse Kristen? We did change it. You just didn't know it. We changed the living shit out of his therapies. It's just that it took this conversation for this woman to hear the abomination coming out of your mouth as a representative of this hospital, for her to realize that if she didn't double down on what she already knew, because I treated her on Friday, this was Saturday, and she was like 80% better, and she knew. She watched it happen to herself. The complete turnaround in her symptoms, which actually gave her the stamina to be able to deal with your hyperbolic idiocy and evilness. Had she not had that kind of a miraculous turnaround, she probably, there's a likelihood, Nurse Kristen, that she may have doubted what I was saying, and possibly she didn't believe any word you said, because everything that came out of your mouth was like a den of lies. But
And we either give it IV or orally. And your husband is getting 6 milligrams every day orally. Get that?
He's getting the orally?
Orally, yes.
When he was getting it in his IV.
so oral or IV doesn't matter. It's useless.
Pardon?
Brenda, when I talked to the nurse this morning,
So the IV ended today, and that the PO starts tomorrow. So we do it for 10 days, and we initially do IV, and then we transition to PO.
but why are you stopping the IV if the IV is better for him?
The IV is not necessarily better for him. It just gives him a more concentrated initial bolus, and then you transition to the oral after a couple days.
So I was busy texting her, letting her know to not challenge that, because that was fine. IV or oral doesn't matter. It's just that it was the wrong medication, and for sure the wrong dose. So I was trying to not let her fight a fight that wasn't worth fighting. So that was the pause.
And what is that based on? I mean, what is there studies that show that that's beneficial to the patient?
There are studies. I can't look them up for you right now tonight. But I would encourage you to look, Google Scholar is a good place to look because those are accredited scholarly articles that are published in their reviews of studies done in hospitals and or clinics. Dexamethasone is also what is prescribed outpatient for people who are not sick enough to need the hospital.
But I can also find studies that say that there's other treatments that can be done. I mean, there's a whole slew of treatments out there.
Like which ones are you worried about? Let me see if I can help.
Why isn't he getting? Why aren't you checking for a secondary infection? Why isn't he getting antibiotics for that?
Because there's no evidence he has an infection.
There's no evidence he doesn't.
I honestly feel like you guys you admit him in, you cut him off from his family, and you wait for him to die. I mean, that's really how I feel, and it's so frustrating right now.
I imagine you're terrified.
I imagine you're terrified. Yeah, Kristen.
And I don't blame you. You should be. And I so wish that we had a way for people to safely, interact with their families.
I wish we had a way for people to safely interact with their family. She was safely interacting with her family, with her husband, up until the point that he went to the hospital. They were both sick. So if they were hanging out together, laying in bed next to each other until a couple nights ago, why can she not go in and see him? Especially if she puts a mask on, which would absolutely protect her from sorry, she already has COVID, and all y'all are wearing spacesuits, so why would she be worried? Why would you be worried about her going in to be with her husband if y'all are wearing spacesuits and she doesn't give a shit? Nurse Kristen.
So badly. I want you to know that the nurses here, and every nurse I know at every other hospital, we're doing our best to be these people's families while we're here. We are treating them like they are our family.
I guess what I'm frustrated about most, Christine, is your protection of not letting me talk to the doctor. So keep telling me that there's no doctor who's going to call me back. And then when I try to find somebody who has medical information to be an advocate for me, you shut him off and say you won't talk to him. And I'm just an average Joe. I don't have a medical degree. I don't spend thousands of hours reading about it. I can turn on the news and I can get one information. I can, depending if you say Google, great. I can Google.
No, not Google. Google Scholar. There's difference.
And I can go to a site, all different medical sites, and I can get a full array of information. And you know what? I really don't care about any information except for what's going to help my husband. And what I hear from you, though, is that, hey, I can't talk to the doctor. Doctors come
Tonight.
because there's plenty of other people that they won't have. But I've been asking for 3 days, and the doctor hasn't called me. So...
Hasn't called me, not coffee.
I'm so sorry that that has happened.
I don't have a lot of confidence in this, normally in a non-COVID world, if he wasn't with COVID,
In a non-COVID world.
and he was in there, I could be there with him, and I could ask him, I could question to the doctor, see him face to face, because you know what, when you see a doctor face to face, they don't hide. I feel like right now, you guys are hiding the doctor from me. You're not letting me talk to him. And I understand you guys are in a hard spot, so I'm not coming down on you. You guys have been put in a spot first to protect these doctors and just carry out the orders. You don't make a decision. You just carry out what they have, what they say, and tell you to do. But yet, you guys are also been charged with protecting them so that they have no legal liability with any of this. Then are they really doing everything that they can? Are you guys, why not keep giving them the dexamethasone and then treat his blood sugar? have. That's simple to treat. You know, I don't understand why, like, you're doing just a little bit, but the doctors won't even talk to me to try to even just discuss anything more, anything different.
I imagine you feel completely powerless to help your husband.
I imagine you feel completely powerless.
Well, yes, because you won't let me talk to her.
I will not.
Please just stop. That does not help me when you're yelling at him.
I am raising my voice, but I have now explained myself multiple times that I will not have that discussion. I will not discuss with him. And what I will tell you is I don't know who this person is to you. It seems like they care very much about you and your husband, and I can see that. But what I will tell you is that a reputable person, a person in the medical field who actually is knowledgeable would know the difference between a bacterial and viral pneumonia, and they would know how we are able to determine the difference, and would not have needed me to explain that, and would have known that we do not need to go down into your husband's throat and sedate him to get an adequate sample of mucus in order to send to the lab to verify that it's COVID, because we already know.
You can do a nasal swab.
I'm going to end the phone call, and I will refer you to patient relations. In fact, I'm going to put you on hold and give you the phone number, and that's who you will speak with from now on. Just a moment.
No, it's fine. Like, she's literally useless, and patient relations is better. Like what she's saying, like a reputable person would know the difference between COVID pneumonia. If they didn't do any cultures, they have like all it takes.
I have a phone number and a name for you.
Okay?
Her name is Michelle Richmond,
Oh, thank God, I know her.
and the phone number is 360-487-3498. I believe that she's checking voicemails on the weekend. You can call that at any time. And she will set up a plan for you on how you will get updates moving forward.
A reputable doctor would know how to treat pneumonia and COVID. Yeah, you should. You are shocking. You are shocking that you will not care for him.
It's very unfortunate that you are misleading this poor woman. Very unfortunate, and you should be ashamed of yourself. Sherry, do you have any questions?
It is very unfortunate that you are misleading this woman, and you should be ashamed of yourself.
Before I hang up.
No.
Yeah, Sherry, ask her why
Sherry, do
you are shocking that you will not care for him. You are shocking. You are shocking that you will not care for him.
It's very unfortunate that you are misleading this poor woman. Very unfortunate.
It is very unfortunate that you are misleading this poor woman. It's very
Very
unfortunate.
unfortunate, and you should be ashamed of yourself. Sherry, do you have any questions before I hang up?
No.
Yeah, Sherry, ask her why she doesn't care.
And I am very hopeful
Yeah.
that your husband will recover.
Yeah, without any treatment. Without any
The
treatment.
physician would like
Put him in
your
prone position. Just put him in prone position. Don't give him any treatment. Just don't give him any treatment.
Conversation.
No, seriously, don't give him any treatment. Just put him on his stomach so he can beat COVID. Yeah, well done.
Okay.
So you are amazing.
Thank you.
You are, oh my gosh, you're a rock star. I can't believe it. What you did. But you don't understand what you did. I mean, I didn't say anything. What you did, like all the questions, because they have to document that. They're not going to say what I did. They have to document what you asked. Like that has to go in a chart note. Like that puts them on notice. And so the doctor in the morning, you didn't back down. I mean, we're looking at what, 40 minutes where you talked to her. You did not back down. I've listened to people just kind of cave. You stepped on the pedal for your husband. I don't know that you realize how much that matters. Because tomorrow, like, they have to look at that, and the doctors be like, uh-oh. Like, you know stuff. Like, they're on notice.
Okay. Well, if there's anything to help, give him some help.
Well, they're not going to say what I did. They have to document what you asked. Like, that has to go in a chart note. Like, they're not going to say what I did. They have to document what you asked.